Stand the toes of both feet and slide the toes on the floor downward. Knees lifted and extended. Move the left heel down without sliding the toes on the floor. When you push the heel down, the distance between the heel and the hip becomes longer. The knee automatically gets lifted. Do it with both legs. Push heels away from the hips. This time, roll the pelvis to lift and extend the left knee from the floor, without moving heel nor toes. Which way does the pelvis roll? How does the spine move along with the rolling of the pelvis? Do it with both legs. Lift and extend knees by rolling the pelvis. This constrains the direction of the rolling of the pelvis clearly. Which direction the pelvis roll now? How does the spine move? Do you feel any movement around the neck? How about the scapular? How about the chest area? Roll the pelvis and push the heel downward together. This is a combination of the two movements that extends the knee. Do the same with both legs. The direction of the rolling of the pelvis is different now. By the constraint, the movement of neck changes and the movement of the spine changes. Heels go away from the hips. The hips go away from the heels. Both knees are lifted. Roll the head. Roll the toes of the feet. And bend and extend knees. Feel the difference from the beginning of the lesson. Bend and extend the left knee while the heel stays touched with the floor. The pelvis comes down a little bit. Straighten the knee without lifting the pelvis. Can you do it? You find it impossible. Bend the left knee without lowering the hip. By lifting the heel. When you extend the knee, you simply lower the heel without lowering the hip. Lift both heels from the floor to bend the knees. You may find it difficult to keep the balance. You may lean on the pillar or chair. When you lift or lower the heel, the pelvis does not go up and down. Whether you extend or bend the knees, the height of the pelvis stays the same. Bend the left knee by lowering the pelvis. Then lift pelvis to straighten the knee. Do the same with both legs. Lower the pelvis down to the floor to bend knees. Heels stay on the floor all the time. Let's combine the two movements. Lift the left heel and lower the hip to bend the left knee. The heel comes down to the floor and the hip lifts so the knee extends. Do the same with both legs now. It might be a bit awkward to begin with. Heels lifts and the pelvis lowers. Knees bend and extend. Heels go down to the floor and the pelvis lifts.